Hi, I'm Jacqueline Borden. I am a Purdue Global University student, and I am going to discuss with you Rare Disease Day, which is a resolution bill, and the impact of this bill and American Nurses Association standard of practice for rare diseases. I'm going to share my screen with you. I have created a PowerPoint in regards to this. So let me make it big. Okay, Bill Resolution, Rare Disease Day, February 28th, 2021, by Jacqueline Borden in Purdue Global University. Professor Haslip, and this is a virtual assignment 3. The world of rare diseases. Rare Disease Day is worldwide and is celebrated on February 28th of each year. This teaching module will discuss the impact of this bill and the American Nurses Association standards of practice for rare diseases. Very few people have the condition. Patients and families attempt to avoid stigmatization, personal growth, unemployment, loneliness, and lack of social interactions and isolation. So obtaining correct diagnosis is very difficult with limited access to rare disease specialists. Little or no information available about the rare diseases. There's little or no research interest. Very few approved investigational or repurposed treatments are available. Increased risk acceptance, risk tolerance, and more risk benefit assessment by patients, families, and healthcare providers. Little or no hope for the future without proper programs and studies and implementation of the 21st Century Cures Act. Diseases focus clinicians, 90% of patients diagnosed by a specialist, 44% by local specialists, 28% by a regional specialist, and 17% by a national specialist. 37% of patients and families with rare diseases had to borrow money from another family member or friend for care. Here in slide 4, you see the purpose of Rare Disease Day is to harness the creativity and energy of the millions of people around the world with rare diseases and the millions who care about and assist them to raise awareness and generate action. The bill was created to expand and improve the programs and activities of the Department of Health and Human Services for awareness, education, research, surveillance, diagnosis, and treatment concerning rare diseases and conditions. That the Senate designates February 28, 2021 as Rare Disease Day and recognizes the importance of, with respect to rare diseases and disorders, improving awareness, encouraging accurate and early diagnosis, and supporting national and global efforts to develop effective treatments, diagnostics, and cures. So why the increased activities in rare diseases? Increase in scientific opportunities and public recognition that rare diseases represent global public health issues. Partnerships and individual commitments exceed expectations. There's an increased expectation for expanded roles of patient advocacy groups as research partners with improved patient recruitment and increased risk acceptance, risk tolerance with access to critical mass patients. There's a need for an increased number of research investigators reaching a critical mass, experienced in study design of rare diseases with multi-center international clinical trials with small patient populations. There's an increase in information technology use, internet access, expansions of digital technology and social media, crowdsourcing, blogs, and mobile apps, all leading to increased public interest. We're seeing more publicity about the undiagnosed diseases, genetic testing, gene therapy, stem cells, gene editing, and personalized precision medicine. We are establishing global medical, scientific, and patient advisory boards, supporting research and new investigator training programs, providing ready access to media and educating patients, public, media, and healthcare providers, identifying research efforts and translate research results to communities, organizing research-based conferences and meetings for research patients, families, and caregivers, and then recruiting patients for patient registries, biospecimen repositories, participation, natural history studies, and clinical studies and trials. So for the American Nurses Association standards of practice, which impact staff and delivery of care, the standard one is assessment, accurate collection of patient data related to patient's health condition. So you want to allow for extra time for the patient's visits, and rare diseases are complex. Provide visual learning aids when available. Provide a summary for each doctor visit to help the patient manage their disease and clarify medications. Provide resources and encouragement for patients requiring change in behaviors to manage their disease, and encourage patients' involvement in decision-making and treatment processes, programs for disease process management, and guidance for healthy behaviors. The American Nurses Association Standards of Practice, Standard 2 is diagnosis and analyzed focus of patient data to address healthcare issues. Data can be subjective, which symptoms, sensations, feelings, behaviors, beliefs, and perceptions. Data can be objective, which is observed signs of illness, which are seen, heard, felt, or smelled through physical examination. Standard number 3, outcomes identification, identification of outcomes created for individual treatment for the patient's illness. So much as diagnoses are identified and prioritized for assessment data, outcomes identification refers to the formulation of specific, measurable, achievable, realistic, and time-framed outcomes. Specific, the outcome must be clearly defined and understandable to all team members. Measurable, the team must be able to determine if the outcome is attainable and what improvement or movement must be accomplished, increase, decrease, size, and number. Achievable, all team members determine what the outcome should be. And realistic, the team agrees that the outcomes can be achieved and the current clinical condition and resources are available. And time frame, the team identifies the time needed to achieve the outcome. The healthcare consumer's temperature will decrease to normal or to baseline within 4 hours after administration of antipyretic medication. This is an outcome, and this is an example of an outcome. Or the healthcare consumer will reduce smoking to less than 1 pack per day within 1 month following daily administration of the patch. So this is another example of a good outcome. So slide 10, standard 4, planning development of a treatment plan to reach expected outcomes for the patient's illness. Based on the assessment and diagnosis, the nurse sets measurable and achievable short and long range goals for this patient that might include moving from bed to chair at least 3 times per day, maintaining adequate nutrition by eating smaller meals, more frequent meals, resolving conflict through counseling, or managing pain through adequate medication. Assessment data, diagnosis, and goals are written in the patient's care plan so that the nurses, as well as the other professionals, healthcare professionals caring for the patient, has access to it. So implementation, American Nursing Association Standards of Practice. Number 5 is standard implementation, putting the plan of care into action. Nursing care implemented according to the care plan, so continuity of care for the patient during hospitalization and in preparation for discharge needs to be assured. Care is documented in the patient's record. So then coordination of care, slide 12. Care coordination involves deliberately organizing the patient care activities and sharing information among all of the participants concerned with a patient's care to achieve safer and more effective care. So what this means is that the patient needs and preferences are known ahead of time and communicated at the right time to the right people. And this information is used to provide safe, appropriate, and effective care to the patient. So there are some examples of specific care coordination activities for the patient: establishing accountability and agreeing on responsibility, communicating, sharing knowledge, helping with transitions of care, assessing patient needs and goals, creating a proactive care plan, monitoring and follow-up, including responding to changes of the patient's needs. So standard 5B, health teaching and health promotion, incorporate strategies to educate and promote safety for the patient. Nurses can direct people to local resources and to give out health and wellness information. Telehealth would be useful when patients seek symptom management, information on vaccines, clinical trials, counseling, mental health, resources, nutrition information, etc. Patients with a rare disease present unique challenges for primary care providers. Obstacles to caring for these patients include diagnostic delays and lack of information, expertise, and treatment options for many rare diseases. Primary care physicians play a vital role in enhancing the quality of life for patients and families living with a rare disease by making appropriate referrals to specialists, helping to coordinate care, and assisting patients in obtaining the proper support. Standard 5C, consultation, collaboration with the patient to enhance the plan of care and provide resources to help the patient manage their disease. An early diagnosis in rare diseases and monitoring of patients, especially in very complex situations, is most efficient when performed in highly specialized centers, which comprehend multidisciplinary teams and advanced scientific and clinical competencies, thus allowing patients to promptly benefit from new treatments and knowledge. Standard 5D is treatment. In accordance with the state laws, the advanced practice nurse expedites the plan of practice through utilization of prescriptive authority procedures, referrals, treatments, and therapies. Both the patient status and the effectiveness of the nurse care must be continuously evaluated and the care plan modified as needed. Evaluation is the final step of the nursing process. It's crucial to determine whether, after application of the nursing process, that the client's condition or well-being improves. The nurse applies all that is known about a client and the client's condition, as well as the experience with previous clients, to evaluate whether nursing care was effective. The nurse conducts evaluation measures to determine if expected outcomes are met, not the nursing interventions. The expected outcomes are the standards against which the nurse judges if goals have been met, and thus if care is successful. Providing healthcare in a timely, competent, and cost-effective manner is complex and challenging. The evaluation process will determine the effectiveness of care, making necessary modifications, and to continuously ensure favorable client outcomes. Standard 6, evaluation, analysis of progress toward attainment of outcomes, continuous evaluation, healthcare status of a patient, are your goals being met, and are treatment plans cost effective? You want to understand cultural, ethical, legal, and social issues related to data gathering and sharing from multiple populations, increased number of research investigators, experience in rare disease multi-center international clinical trials, and global distribution of patients requires global linking of patient advocacy groups, research investigators, and protocols. So challenges, patient recruitment. This is a path to success, partnerships and coordination of efforts, and the rare disease community. So there's connection, collaborative connection. You have organizations like ICORD and IRDIRC, regulatory agencies, federal and local research agencies, reimbursement, sequencing centers, healthcare providers and services, medical specialists, academic researchers, research centers, and the industry. Here is a diagram of what I was just discussing. So here's some contact information for genetic and rare diseases, toll-free number, international number, fax, email, and also mail in Gaithersburg, Maryland. And here are my references. So this is the end of my presentation. And if you have any questions, please contact Purdue Global, Jacqueline Borden. Thank you.